Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is September 15, 2025. This video is on a letter published in the New England Journal titled Long-Term Outcomes of the Danger Shock Trial, published August 11, 2025 in the New England Journal of Medicine. The Danger Shock was an international randomized controlled trial of 355 patients with STEMIs complicated by cardiogenic shock. Patients were randomized 1:1 to receive either an Impella CP microaxial flow pump plus standard care, 179 individuals, or standard care alone, 176 individuals. Follow-up extended to 10 years via medical records, phone interviews, and national death registries. Exclusions: mechanical complications of STEMI, persistent coma after resuscitation. Demographics were well balanced across groups. The primary endpoint: death from any cause. Secondary endpoint: cardiac replacement therapy. Statistics: hazard ratios from unadjusted analysis with 95% confidence interval. Median time to death and number of days alive at 10 years was calculated. What did they find? 52.5% mortality in the Impella group versus 68.8% in the standard care group. Hazard ratio 0.70. Median survival 577 versus 61 days. Median days alive 600 more days in the Impella group. 95% confidence interval 235 to 966. Sustained survival benefit seen across 10 years. Limitations: higher incidence of adverse events, bleeding, AKI, acute kidney injury, limb ischemia. The confidence interval was not adjusted for multiplicity. Clinical pearls: Impella CP offers a durable survival advantage even a decade post-STEMI with shock. Benefits outweigh long-term risk despite higher adverse events. Patient selection and timing of device deployment remain critical. This trial sets a benchmark for long-term outcomes in mechanical support trials. Criteria for best outcomes with Impella CP: early initiation before end-organ damage onset, younger patients with fewer comorbidities, no mechanical complications, example ventricular septal defect or papillary rupture, preserved neurological status, non-comatose, no prior advanced heart failure, pre-STEMI NYHA class 1 to 2, no significant bleeding risk or peripheral arterial disease, timely and effective revascularization with PCI. Eponyms related to cardiogenic shock: Killip classification by Thomas Killip grades myocardial infarction severity based on heart failure signs. Beck's triad by Claude Beck: hypertension, JVD, muffled heart sounds, suggests cardiac tamponade. Kussmaul sign by Adolphe Kussmaul: JP rise on inspiration, seen in RV infarct, pericarditis. Schwarz sign by Felix Schwarz: hypertension on CAT due to left main occlusion. Swan-Ganz catheter by Harold Swan and William Ganz: pulmonary artery catheter for shock profiling. Forrester subsets by James Forrester: hemodynamic shock categories, warm, cold, wet and dry. The Bernheim effect by Hugo Bernheim: right ventricular overload impairs LV filling via septal shift. The CAST method by David Cast: pressure volume analysis in shock ventricular dynamics. Reynolds pentad by George Reynolds in septic shock with biliary source. Linac stethoscope by René Liniac: foundation for clinical auscultation in shock. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.